Hello guys, this is Dr. Ankita Das and today I have come up with a fun video actually. So let's see the most Googled questions about doctors and let's try to answer it. Okay, come on. So the first question is, do doctors smoke? Well, not all of them, but yes, some of them do smoke, and we know it's not good for our health and everything. We keep advising our patients to not smoke, but few doctors smoke. I know they shouldn't because, come on, guys, it causes cancer. All of us know it. Quit smoking. So the next question is, do doctors have tattoo and are they allowed? Well, there's so many doctors, those who have tattoo. I personally do not have one. And yes, we are allowed to have a tattoo. I've heard from many people that, you're a doctor, you cannot color your hair, you cannot have tattoos, you cannot wear this dress, you cannot wear that dress because you're a doctor, you have to carry yourself. Well, a doctor is known by his or her skills, knowledge, and the way they communicate with their patients, and not by having a tattoo. A doctor who has a tattoo does not mean that he or she is a bad doctor. So yes, doctors have tattoos, and so many of my friends have tattoos, and we are allowed. But yes, if you want to be a doctor in the army, armed forces, then tattoos are not allowed. So yes, that's one thing. So the next question is, do doctors eat junk food? Yes, and 100 times yes. We survive on junk food. Of course, we keep telling our patients not to eat junk food because it has a lot of cholesterol, fats, and everything. But we have to, not have to, we eat junk food because our meal time, our food time is not always at the correct time, because we are working or we are busy in wards, surgery, so we don't get time. So what we do is Zomato and Swiggy. Trust me, guys, 80% of our salary goes to Zomato and Swiggy. So yes, we do eat junk food. Well, I personally question. Do doctors have medical insurance? Yes. Medical insurance has nothing to do with doctors or non-doctors. Everybody should have a medical insurance. I personally have a medical insurance. People keep saying कि हाँ डॉक्टर है, ट्रीटमेंट फ्री में हो जाएगा. नहीं, कोई भी ट्रीटमेंट फ्री में नहीं देता है, स्पेशली द प्राइवेट हॉस्पिटल्स, बिकॉज ऑफ कोर्स व्हाई वुड दे, I have to pay the doctor who sees me, and I have to pay for the investigations, I have to pay for the bed. Just because I'm a doctor, that does not mean that I will not pay for it. So yes, medical insurance, everyone should have a medical insurance irrespective of being a doctor or a non-doctor. So the next question is, do doctors study all the time? Good question. Not all the time, but we do have to study a lot because during college we used to have regular tests, semesters or final exams, or just regular class tests. So we have to study a lot. Also, after your college, when you are into practice, you have to study a lot to keep up with the updated protocols, the updated the new medicines or the new investigation that has come up, or the research to have an evidence-based practice. So yes, we have to study a lot, but we do not always study. We also party. You should see doctors partying. When we party really bad. So yes, and I would recommend all of the MBBS students that guys, do not always sit in your room and read. Go out, have fun, because just because you're a doctor does not mean that you're not allowed to have fun. So as I always say, study hard but party harder. So yeah. Okay, so the next question is, do doctors get paid more than engineers? Well, this is a very tricky question because by the time we pass our medical college, our engineer friends, they're already earning. Some are earning in lakhs. So, but eventually, I think doctors start earning a lot after they have set up their own clinic, or after they have become a consultant by the age of 35, 40. Actually, it depends upon for doctors. And for engineers also, in which company you are working, for doctors also, in which specialty are you working, and how you are practicing. If you feel like you want to practice 12 hours a day, of course you will earn more. If you want to practice 8 hours a day, you will earn less. So it's like that. Personally, I have seen my professors earning more than 40 to 45 lakhs per month, yes. But they are surgeons. Surgeons do get paid a lot. Yeah, this is a tricky question. I mean, there is no particular answer to this. I really don't know. So the next question. Okay, so the next question is: do doctors clear NEET in 7 attempts? Be it NEET UG or NEET PG, there are doctors, those who clear it in the first go, and there are few doctors, those who have to take 1 or 2 drops. But trust me, according to me, it does not depend how many attempts you have taken. Ultimately, it depends. Ultimately, it's that you become a doctor and you're practicing and you have achieved your goal. So the drops do not matter. I think at the end of the day, when you become a doctor, when you are successful in treating your patients and cure them from their ailments, is what makes you a good doctor. The number of attempts does not make you a bad doctor. So some do take 2 or 3 attempts and some get it at the first go. So yeah, that does not decide someone to be a good or a bad doctor. So the next question is, do doctors get holidays? Well, we do get holidays, but not that much as engineers, and also sometimes when we are on our holidays, we are continuously getting calls from our patients or from the hospital. So we are working even when we are off duty or on holiday, especially with Indian doctors. So I think after when you start working, I think every day you're working and never off work. But yes, you can take 10 to 15 days holiday and go. But by that time, after you come, you have a whole lot of patients waiting for you. You have a whole lot of surgeries to do, or patients to see. So yeah, but I think, but yes, we do get holidays. If you have any other queries that you want to know, then you can write in the comment section below, and I'll be happy to help and answer.